Governor Joe Lombardo signed some measures into law, but vetoed others, including one aimed at protecting transgender health care. I sat down with Silver State Equality Director Andre Wade to break down what passed, what didn't, and what it means for Southern Nevadans.
This year's legislative session brought forward key bills aimed at protecting LGBTQ+ rights in Nevada, but not all of them survived, including Senate Bill 171.
The gender-affirming care shield law, which will provide protections for providers of gender-affirming care and those seeking care from another state. And it's really timely that this is happening because of the Supreme Court decision.
Andre tells me the bill would protect providers from prosecution or disciplinary action, including those helping out-of-state patients. But Governor Joe Lombardo vetoed the bill, writing SB 171 is well-intentioned but has a critical ambiguity. This introduces a potential conflict between a patient-specific clinical judgment and a generalized notion of prudence. On June 18th, the U.S. Supreme Court upheld a ban on gender-affirming care for minors in Tennessee, a decision that could have ripple effects across the country. Despite shifting national landscape and Governor Lombardo's vetoes, Wade says Nevada still offers critical access to care and protections that remain in place.
We are good that this decision from the Supreme Court will not impact care that is in Nevada. In Nevada, gender-affirming care is legally available.
Andre tells me there were still wins, with Senate Bill 117 signed into law. This bill requires the Department of Veterans Services to expand outreach and help to LGBTQ+ veterans and their families upgrade discharge status and access benefits.
We're thankful that our LGBTQ+ veterans who were less than honorably discharged during that era have a pathway for accessing full benefits.
Also signed into law this session, a bill that allows reproductive and gender-affirming care providers and their families to not have to publicly share personal information from public records and state IDs.
We know that, unfortunately, that there are healthcare providers who are attacked.
Now to a big change nationally for the LGBTQ+ community. The federal government scaling back on a major resource. Starting July 17th, the 988 Suicide and Crisis Lifeline will no longer offer its dedicated Press 3 option for LGBTQ+ youth. The Substance Abuse and Mental Health Services Administration says the Lifeline will shift to a model that serves all callers under one system. If you or someone you know is struggling, the standard national 988 crisis hotline is still available 24/7, but I also wanted to find more local resources that are dedicated to helping the LGBTQ+ community right here in Southern Nevada. Right there on your screen are a few. First, the Center, also Silver State Equality and Gender Justice Nevada. Of course, I'll have a full list of these and more with this story on our website at KTNV.com. Reporting in the studio, I'm Abel Garcia.